Welcome to Let's Get to Work, Reimagining Disability Inclusive Employment Policy, brought to you by the Burton Blatt Institute at Syracuse University. And now, here's your host, Michael Morris.
Burton Blatt Institute at Syracuse University, in collaboration with leading economic and social policy researchers at Rutgers and Harvard universities, welcomes you to our podcast series, Let's Get to Work, Reimagining Disability Inclusive Employment Policy. As so many of us know, too many people with disabilities remain outside the workforce, and an issue which has been before us for several years now is COVID and how it's impacted people's employment. And today we're going to hear from an expert from an advocacy perspective. I'm so pleased to introduce you to Andrew Wylam, who is the president of Pandemic Patients. He will be sharing with us information about his organization and perspective on disability policy as it affects people with COVID and particularly people with long COVID. So welcome, Andrew. We appreciate you joining us today.
Thanks so much for having me. It's really nice to be here.
So let's jump right in to tell us a little bit about the history and the creation of Pandemic Patients. What was the motivation? What was your interest as a founder of the organization? How do you fit your background and area of expertise into this important organization?
Sure. So I like to start with my personal background to really get to the motivation of why I started the organization. And that really goes back to when I was a federal lobbyist in Washington, D.C. I was working for the National Multiple Sclerosis Society in their DC Public Policy Office. And I like to think that that work really prepared me in a lot of ways to anticipate the needs and experiences of people affected by long COVID. And the connection there is that during the pandemic, we learned that multiple sclerosis can be triggered by prior viral infections. So there does seem to be a common thread there, conditions. So during the coronavirus pandemic, I saw that as an opportunity to establish a patient advocacy organization for people affected by COVID. And that's where the name Pandemic Patients came from. Our audience is mainly people whose health has been affected by the pandemic. And as I'm sure many people can relate to, the world turned very dark during the pandemic, but by creating Pandemic Patients, it really helped me process the shared trauma that we were all going through. And through the organization, I felt like I could contribute something to make the world a better place. So when we think about the goals for the organization, they were initially pretty broad. Back in 2021, when we were founded, the vaccines were first starting to get rolled out, and we focused on messaging around vaccine availability and eligibility, along with raising awareness about prevention strategies. And over time, we've turned our focus more to the long-term impacts of COVID-19 and long COVID specifically.
And as an organization, do you see yourself as, you're not a research organization, you very much focus on advocacy?
You know, I would love to participate more in research activities generally, but those are typically very expensive activities. So I consider us a advocacy organization, but within that umbrella, we are a services organization. And that's something that I think distinguishes us from other organizations in this space.
As you said, the organization has evolved. Who do you look at as your target audience?
So right now, I think it's primarily people who have long COVID, people who are experiencing any long-term symptoms after a COVID-19 infection, but also, you know, their friends and their family members, their caretakers, the people that are close to them, whose lives have also been affected by this.
And among the things that the organization has done is to establish a pandemic legal assistance network to help COVID-19 survivors. Can you tell us a little bit about how you put that together and what kinds of outcomes are you seeing from the legal assistance being provided?
So as you mentioned, our Pandemic Legal Assistance Network is a program that we created to provide pro bono legal assistance to people affected by COVID. As you mentioned, our Pandemic Legal Assistance Network is the program we created to provide pro bono legal assistance to people affected by COVID. And this is predominantly utilized by people with long COVID who are facing issues related to disability and employment. Our strategy involves recruiting attorneys who can provide legal assistance and fielding inquiries to our network from people who need help. So predominantly, this includes private disability insurance claims and appeals, Social Security disability insurance, disability discrimination in the workplace, reasonable accommodations, unemployment compensation, and workers' compensation. Other issues do come up less frequently, and we try to help with those when possible. But generally, people with long COVID often have cognitive symptoms that, when combined with fatigue, can make the process of filing claims or appeals confusing and overwhelming. A disability appeal can require going back and forth with your doctor, collecting and reviewing hundreds or thousands of pages of medical records, interpreting the terms of your policy, and picking apart your insurance company's rationale for denying your benefits. That's why having dedicated advocates is really important. And without help, some people lose the opportunity to pursue valid claims or appeals because they're just overwhelmed by the process. And so, to answer your question about outcomes, we've helped a lot of people obtain disability benefits or secure reasonable accommodation from their employers. And we're also involved in some of the first cases of disability discrimination against employers. We've also helped student borrowers obtain total discharge of their student loans from permanent disability. But most importantly, these disability discrimination cases are extremely important to us. But as I'm sure our listeners are aware, the EEOC can take a very long time to resolve those. So a lot of those are pending.
And you've mentioned that long COVID is a disability. Can you talk a little bit about perhaps your organization had a role in advocating for the coming under the protections of the ADA and Section 504 of the Rehabilitation Act? What does it mean to be considered a disability? What protections then are offered to individuals with long COVID?
So as you mentioned, the HHS and DOJ issued guidance that defined when long COVID can qualify as a disability under federal law. And in short, it's considered a disability when it results in a physical or mental impairment that substantially limits one or more major life activities. When a person's long COVID symptoms meet these criteria, they are afforded protections in the workplace, such as protection against being discriminated against on the basis of disability. Importantly, I want our listeners to note that having a diagnosis of long COVID does not automatically mean you're disabled. Your symptoms must be severe enough to substantially limit a major life activity. So an example of that would be a person with long COVID who has lung damage from their COVID-19 infection that impairs their ability to breathe. Another example would be a person with long COVID who has cognitive impairment, which limits their memory or concentration. For people who meet these criteria, the Americans with Disabilities Act protects them against adverse employment actions that are motivated by discrimination against people with disabilities. So that would include job applications, hiring, promotion, compensation. It would protect against wrongful termination, and there are other privileges of employment that are involved. So the ADA, it also requires employers to provide accommodations for people with disabilities, which are modifications or adjustments to a person's job or work environment that enable them to perform the essential functions of their job.
Do you help people who reach out to you and then receive assistance from the Pandemic Legal Assistance Network to talk about kinds or options that might be considered under the term reasonable accommodation? Obviously, it matters in terms of each individual circumstance, but can you talk a little bit more about reasonable accommodations?
Absolutely. So people do reach out to us about this issue, and we do provide help when we can. One of the good resources out there is the Job Accommodation Network. They provide a resource specifically for employers and employees regarding reasonable accommodations, and they've published a guide that includes some great examples. So As you mentioned, it's a very fact-specific inquiry about what accommodation will work for a certain person, depending on their job responsibilities and their functional limitations caused by their condition. But for someone with long COVID, allowing them to work remotely is often helpful, but it's not a silver bullet. It's not a fix-all. But for people with fatigue symptoms, employers can provide more frequent breaks, or they can reduce the physical requirements of their position. We've also found flexible schedules to be helpful, and long COVID patients may need to frequently visit healthcare providers to manage their care. So allowing additional time allowances for healthcare visits can also be a reasonable accommodation. So when people come to us for help with this issue, we try to provide some educational resources that they can look to help them talk to their employer about options that might be a good fit for them.
Prior to our COVID pandemic, the whole issue of working from home or working remotely as a reasonable accommodation was really often met with rejection by employers, mixed results in the courts. Have you seen that becoming more an option? It depends on the job, the essential skills of the job, but is this something that is at least more hopeful as an accommodation for people with long COVID?
Mm-hmm. So before the pandemic, I think generally there was pushback on remote working because an employer might say it's not reasonable. It might be an accommodation, but it's not reasonable to provide, or it would cause an undue hardship on the employer to provide it. And I think what the pandemic has demonstrated is that when so many employers were forced to allow remote working, that demonstrated that they could provide that as an accommodation. It wasn't unreasonable, and it didn't provide or impose an undue hardship. So I think that's made the argument a lot easier for people to make when they're saying that that's something that they need and it's reasonable.
Thank you. Let's talk about another facet of your organization. You have the COVID-19 Advocacy Center. Can you explain a little bit, how does it help engage stakeholders, and who are the stakeholders, again, you're trying to support?
Sure. Our COVID-19 Advocacy Center is a tool that we use to connect advocates with their elected officials. When we identify legislative or regulatory issues related to our policy priorities, we take direct action by writing to policymakers about the issue or meeting with them directly, and then we broaden our efforts to include people across the country. So we use software that allows us to host a form on our website that's pre-filled with all the important information related to the issue, and then members of the public can use that form to send a customized message to their elected officials in support of our position on that issue. And in terms of audience, anyone can use our COVID-19 Advocacy Center, but it's most relevant for people who have been directly affected by COVID-19 in one way or another, and people who have powerful personal stories they can share.
Great, that's very helpful. In terms of public policy, can you give examples of public policy development that you're currently working on and might be of interest to our listeners?
There are a lot of things that were implemented earlier in the pandemic that were very helpful for COVID-19 prevention. One of those was paid sick leave. When you have paid sick leave guaranteed, you can take time off of work when you're sick, and you aren't necessarily worried that you're going to lose your job as a result of taking that leave. And when those support packages ended that Congress passed earlier in the pandemic, guaranteed paid sick leave ended as well. And we would like to see there be a national standard for paid sick leave so that when people do get sick, they can fall back on that and take care of themselves. And hopefully they're able to recover during that time and not get worse. There was also better coverage for at-home tests and antiviral treatments earlier in the pandemic. In terms of policy, I really think that insurers should be required to provide coverage for at-home tests, and right now they're not. There are also opportunities for better workplace safety standards so that when people go to work, they can feel confident that they're not being unnecessarily exposed to COVID. And one of the easy things that we think should be implemented in that regard is better ventilation standards. And that would need to come from OSHA. We have supported those standards on a state level in California. Last year, they passed one of the strongest workplace safety standards we've seen. We were very supportive of that. But alongside that, it also has to do with masking in healthcare facilities. I think when people go to access healthcare, they should feel safe that their healthcare providers are masking around them and not exposing them to COVID unnecessarily. We also would love to see more funding allocated to research for long COVID. Particularly, we'd like to see prioritization of interventions that address chronic fatigue and cognitive impairment so that patients' functional capacity can be restored.
You shared with me that one bill that you're working on is called Care for Long COVID Act. Can you talk a little bit about that bill? You know, what's its intent and what's its likelihood of moving forward?
Sure. The Care for Long COVID Act is one of the best approaches we've seen to provide relief to people with long COVID, particularly related to disability and employment. The bill is sponsored by Senator Kaine, who's been a really great ally for people affected by long COVID, and he reintroduced the bill in March. The Care for Long COVID Act approaches this issue from a few different angles, but in summary, it would coordinate long COVID research through HHS and PCORI. It would fund research through HHS to study the U.S. health system's response to long COVID, and it would provide funding to educate patients and healthcare practitioners about long COVID. And one of the most important sections would promote education for employers and schools on the impact of long COVID and the rights associated with disability, employment, and education. The bill would also establish funding to develop partnerships between community-based organizations, social service providers, and legal service providers to help long COVID patients access needed services. And if you look at how we approach long COVID as an organization, we're strongly aligned with this proposal. The funding for legal and social services would have an enormous impact on programs like the Pandemic Legal Assistance Network, which could have an even greater impact with more resources. The funding for each of these focus areas is important because there aren't a lot of federal grants available for projects related to long COVID right now. So this bill would make important investments in the work we are doing to provide support to long COVID patients. So this bill was reintroduced earlier this year. We made a pretty good push for it earlier in the year, but we have seen that a pared down version has been introduced in the Senate that has received more bipartisan support. But unfortunately, that version didn't include a lot of the important components that we prioritize from the Care for Long COVID Act. So we're not really sure what the path forward is from here, but we are supportive of that original proposal.
Is there a companion bill in the House as well?
There is, yes.
In the world that we live in, although if you've personally been connected to COVID, experienced it, a family member has experienced it, a friend, a coworker, you certainly understand the importance of advocacy to talk about the changes as in the bill that you just spoke about. Is it hard getting people's attention who are policymakers around policy change to support the needs of people with long COVID?
I think that is definitely a challenge. I think there is pandemic. People are kind of tired of hearing about things related to COVID, and that does make them resistant to working with you on solutions. And, you know, some people say long COVID isn't real or that it's just caused by the COVID vaccines. So that's not something that they should be responsible for. And there's some people who are resistant to government spending generally, and they're resistant to spending money on COVID-19 prevention and relief for people who've been affected. Some people have convinced themselves that the pandemic is over and that we don't need to do anything else. And then there are some, broadly speaking, some general policy changes that would involve larger structural changes to government safety net programs like Social Security. And so for policymakers who want to reduce spending on those programs, they see those reforms as unnecessary.
Well, and when you mentioned Social Security, individuals with long COVID are eligible for Social Security benefits. But as I've talked with quite a few people, proving that you have disability that's long-term and permanent is a challenge. And it sounds like your legal assistance network is trying to support and help people who have been rejected by Social Security for benefits. What's been your experiences with the Social Security Administration, and what more can be done?
We do get a lot of people who need help with Social Security disability insurance. And one thing for our listeners to keep in mind is that program has among the strictest eligibility requirements for any disability insurance program. So when we talk about being eligible for that, what you have to prove is so significant in terms of the medical documentation you have to provide and establishing that your condition is going to be permanently disabling. And we've only really known about long COVID for a few years. We don't have great data on the long-term outcomes. We don't have great data on the types of tests that we should be running to see, which of a patient's vitals are, out of bounds to prove that they have a certain kind of limitation caused by the condition. And that has to do a lot with biomarkers. And that is, I think, a large research priority right now of finding out which biomarkers indicate long COVID so that people know what tests they need to go get from their doctor to corroborate their disability based on that condition. But overall, it's been a very difficult process for a lot of people. They've had to wait a year or longer just to get a determination on their benefits. And when someone is out of work, they can't work, they're relying on any resources they can find just to, make ends meet. I think that's a very, very difficult position for them to be in. And then to add on top of that, hey, you need a lawyer and you need to go pay for them. That's a really difficult situation for a lot of people. And there's people out there that are just kind of hanging in limbo while the agency takes their time on adjudicating their claims. And fundamentally, I think that's an issue of funding for the agency. If they had more staff to adjudicate these claims, I think they could work through their backlog a lot faster. And they had a backlog before the pandemic even started, and it's only gotten worse.
I know that for a long period, the public health emergency related to COVID brought a lot of benefits to folks. Based on a congressional resolution signed by President Biden, the COVID-19 public health emergency ended at the beginning in early May of this year. What's the impact of no longer having COVID as a national emergency? What's the result in terms of people who were getting financial relief now not being able to benefit from that, no longer being considered a national health emergency?
This was a pretty significant change for a lot of people, and it really has shifted how the government has approached pandemic response. But there's really two things going on at the same time here. The first, it's about messaging. And when the public health emergency ended, it sent the message to Americans that they didn't need to take this seriously anymore. This wasn't an emergency anymore. And I think that has made people more relaxed when it comes to COVID prevention. They are less likely to mask in a public place. They're less likely to get the latest vaccine. They're less likely to get tested if they feel sick. And I think that has some pretty serious public health consequences when you look at things broadly. But when we get down to the actual policy of what changed with the public health emergency, For this whole pandemic, people were very accustomed to having free access to COVID vaccines, tests, and treatment through government programs. And when the public health emergency ended, the government shifted the cost of vaccines, tests, and treatments back to the market instead of being guaranteed by government supply. So for some people, they really won't notice the change, but for others, the change is significant. So for people with insurance, they will still have access to COVID-19 vaccines as preventive care, but insurers are no longer required to provide coverage for at-home COVID tests. And as you may have seen recently, Pfizer has priced one course of Paxlovid at $1,390, which is higher than the $529 price tag that the drug had when the federal government purchased it in bulk previously. So how individuals experience that cost will vary depending on their source of insurance coverage, but people without health insurance have to pay the full price out of pocket just for one course of Paxlovid. And that could prevent people who need this drug from accessing it. And overall, I think the changes are most significant for at-home tests, and that's one of the most important tools that people have to protect themselves against COVID. When people have to pay $20 or $30 for a pack of at-home tests, even if they have insurance, they may not prioritize obtaining them. And people need to know when they have COVID-19 to know when they should isolate away from others. With more barriers to accessing at-home tests, people will generally be less informed about their status, which can only lead to more community transmission. If you think about the course of a single COVID-19 infection, a person might have to take several tests after their symptoms begin before they actually test positive, and they might need to take several tests as they recover to know when they are no longer contagious. It's really not hard to go through 5 or more at-home tests for a single infection. So fortunately, the USPS has recently resumed providing some free at-home tests, which is good, but we'd like to see the government once again require insurance companies provide full coverage for at-home tests obtained at the pharmacy.
And moving to another area there related to the public health emergency, it provided a period of financial relief related to student loans and mortgages. That's no longer there. And is there any expectation or possibility that financial relief type provisions can somehow come back?
I would say there is low likelihood of any financial relief coming back based on those previous aid packages. Based on just student loans, I think there is some possibility that relief could come back, as just this month in October, so many student loans have entered repayment for the first time since the pandemic started. But from what I'm seeing with the forbearance programs, most of those programs were run by the states, and they have closed their applications for those.
Okay. Let's talk a little bit about mental health. As an organization, mental health has gotten a lot of attention during the pandemic. You've urged more investment in suicide and crisis hotlines. What additional other services should be looked at from your advocacy perspective?
We think mental health is so important when it comes to COVID-19 because it's implicated in so many ways. You know, people are grieving lost friends and family members. They may be suffering due to isolation. They may be grieving the loss of their career, or they may be experiencing mental health issues as a symptom of long COVID. We believe there needs to be a much more robust response to the mental health impacts of the pandemic. So our request recently for the Suicide and Crisis Hotline is for Congress to make sustained investments in this program due to the important roles in triaging mental health crises. One of our board members, Sam Norpel, has also worked to educate responders on how people with long COVID experience mental health crises. So we're very supportive of that program and ways it can be strengthened. And if you remember, it wasn't not long ago that that program didn't exist. So we think it's a great new resource that should receive sustained investment from Congress.
And in talking again about long COVID and going back to the opportunity for protections, although challenging, getting Social Security benefits, being protected against discrimination in the workplace, I would expect that many newly disabled people have difficulty with understanding what does it mean to have a disability and placing that in a context of a new identity. Does your organization also work with people to create support for them in understanding what does it mean to have long COVID and be able to move this to a new level of understanding?
This is a really complex question. For people who have become disabled from long COVID, they're experiencing something new. And that's something I really want to stress here. For some, they are hopeful they will recover, they're hopeful for a cure, and they're hopeful that their impairment will not be permanent. But we can't generalize too much here because some people do get better. But for those who don't, they may really be struggling with embracing the possibility that they're not going to recover. For some, acceptance of disability means defeat, and that is deeply personal and sensitive. So we try to help people realize their new identities by talking about long COVID more. We try to be positive. And I want people to feel empowered to share their story with the world so people will understand how serious long COVID is and make smarter decisions to protect themselves against it. And so again, my message for those experiencing disability from long COVID is remain positive. There is so much research being done and much more coming on treatments for long COVID. The next big breakthrough could be just around the corner. And we know so much more now than we did 3 years ago. And until then, I hope organizations like Pandemic Patients can be there for you. We directly don't provide like a support group for patients. We do have a lot of volunteers that we have developed really great relationships with. But we have seen a lot of other organizations that, for some of them, it's created such a large cost for them that it's simply unsustainable. So I think there needs to be more investment in this so that more support groups like that can exist to provide that really important service and resource for people. But for right now, it's simply not something that we can afford as an organization.
I know that many groups, focused on different specific issues, have managed to create kind of a caucus within Congress. And I'm curious whether are there a group of specific members of Congress who have really taken a focus on long COVID and again, in most cases, these are bipartisan. But I'm curious whether we've reached a point where there are some real strong advocates for helping those people newly identifying with long COVID.
About a year ago, we did have some pretty deliberate discussions about creating a caucus in Congress, and we took that to Senator Kane's office. We talked to the House Care for Long COVID sponsors about it, and at the time, they felt that might not be the best use of our energy, but there are some people in Congress who have become champions for this issue. There are, I'd say, more in the House than the Senate. Senator Kane has been a really great champion because of how he's personally been affected by long COVID. But we have really struggled to find a Republican champion who can really take this issue on and convince his colleagues that this is worth investing in. So that's been that's held up the most progress in Congress for creating new relief programs or giving this the attention it deserves.
And as we look ahead, and as you've talked about it, I have implied in many of the questions, long COVID is not going away. The number of people impacted is growing still. As sort of a kind of closing set of comments, if you were to prioritize from a policy perspective, I think I've heard it. I mean, some of your efforts are prevention oriented. Some of the efforts are, of course, in dealing with quality of life issues for those who are dealing with long COVID. But maybe as a closing set of thoughts, what's the future look like in terms of your advocacy work and what you would aspire to see change in terms of this growing community of people with disabilities who are definitely long COVID members.
As you mentioned, long COVID is not going away, and we recognize that pretty early on, and that's why we have so deliberately made that such a big focus of our work. But over time, as we've continued the work, we have made the decision to focus even more on this intersection that we're talking about between long COVID, people's employment, and disability. And so I think we're going to continue to pursue that. We're going to continue to provide those important services to people who are facing financial insecurity due to their disability, because what we think is most important is maintaining their ability to work, to remain in the workforce, to contribute to society and maintain their identity, because that's what keeps them stable. That's what keeps them afloat with paying their mortgage and paying their household expenses. And so we really think that disability empowerment and employment is so important as we look to the future, because so many people are going to have long COVID. It's going to increase. And we need to make sure that the workforce, employers around the country, are prepared for that. And so when someone says, or when they're exposed to COVID and they start getting long-term symptoms, they don't automatically think, well, I can't work anymore. It's reframing that to say, there's a way that we can keep you in the workforce, because we can build support around you. We can get you the accommodations you need. We can educate your employer on what your needs are and what long COVID looks like for you. And I think that's the role that we can play that is the most impactful, because, in the private market, we don't have $1 billion investment to make in clinical research like the NIH does. We can't match that. We participate in that as we can. And I serve on the NIH Recover Initiative on one of their committees, and I support that work in every way possible. But as a private organization, as a nonprofit, this is the role we see, is bridging that gap between people's disability and their financial security.
Thank you, Andrew. Your organization is doing such extremely important work. Your answers to my questions have been insightful and certainly give a perspective that more needs to be done from the world of public policy. And we're thankful for the work that you're doing and the others working with you. If in the future, someone listening to this podcast wanted to find out how they could volunteer or become a member of, they're an attorney and become a member of your legal assistance network, where should they go? Should they be in touch with you? What can they do?
Sure. I would encourage them to visit our website at pandemicpatients.org, where we've got all that information listed for you. If you're an attorney who would like to provide pro bono legal assistance, there's a section on our website for that. And I encourage you to visit that, learn more about our program, and enroll if possible. If you are someone who needs legal assistance, I would also encourage you to go to that section on our website and reach out to us with your issues so we can see if we can help.
Andrew, thank you so much. We appreciate you spending time with us today, and look forward to continue to follow the progress of your organization, Pandemic Patients. Thank you so much.
Thank you, Michael. Thank you so much for having me.
You've been listening to Let's Get to Work, Reimagining Disability Inclusive Employment Policy, brought to you by the Burton Blatt Institute at Syracuse University. Don't forget to subscribe to the podcast at Apple Podcasts, Google Podcasts, or wherever you listen to podcasts.